How often does your doctor recommend a treatment and offer to tell you the harms along with the possible benefits?
Well, they certainly don't, we certainly don't, in general, emphasize the harms. We kind of emphasize this drug or this procedure could really help you. And so we focus more on that, on the good things and the bad things. And a lot of the time, we have to be honest, we really don't expect our patients to know enough about the treatments that we're giving to explain it all to them. But it's really important to explain things to people because they need to understand why they're taking the drug and what it does and what the potential complications are. It shouldn't be it shouldn't be a decision that's made only by a doctor, unilateral of the patient, the person, and their families.
So many of the doctors don't want their patients to be distracted then from taking the treatment that they've prescribed.
Exactly.
It's easier to just tell them why to follow the treatment and not mix it up with the downside.
Exactly.
Okay, but is this fair to the patient?
Well, I guess it depends on the patient. If the person really isn't able to understand what's being done, then you have to trust your doctor and hope that the doctor has in mind the side effects as well as the benefits, because a lot of the time, as I said before, we're focused on what can we do to make somebody get better, knowing that there are always side effects and risks from medications and technologies.
You know, too, it also turns out that fewer people benefit from the medical therapies than you'd think, keeping in mind that not all will suffer a side effect and not all will suffer or will have a benefit.
Exactly. I mean, look at the case of chemotherapy. You may have one person in 100 who responds to the treatment and think that that's pretty good for a certain situation. And if you look at the number of side effects there are from that, almost everybody may have a side effect. So it depends on what you're talking about.
So we're going to be talking about the numbers needed to treat the patient and the numbers needed to harm so that you can think about whether certain treatments are worth it or not.
Exactly. And so what Vicky's really saying here is, how many patients do you have to treat to get an expected effect that you're looking for? And that number may be a lot different than you think. And then how many people do you have to treat to cause side effects to occur? And how serious are those side effects?
Well, let's give an example. How about aspirin?
Okay, so we're looking at something like aspirin. And aspirin, you have to treat 2,000 people, okay, for 2 years to prevent one heart attack. That's a staggering small percentage of people that will benefit. That's 1/10 of 1% will benefit from it.
And so many people are on aspirin.
Oh, because they're so sure that everything's going to be better. Because actually what happens is the medical literature is full of information published by the pharmaceutical industry that talks about percentages rather than talking about actual numbers. The example I like to give is in Iceland, for example. If there are 100,000 people being bitten, or say 100,000 people that are being studied, and 2 people every year get a shark bite, then a product comes out, and those 100,000 people use the product, and the next year, 1 person gets a shark bite. That's a 50% reduction in shark bites. Now, that's not really being honest, is it? That's throwing percentages rather than numbers around, and that's what happens. So when we say that we lower the risk for heart attack by 25% by using aspirin, wow, you're talking about 1 person in 1,000 benefiting from it. That's not really a fair appraisal of what the real situation is.
And then compared to how many people that it helps, the 1 in 1,000 or 2 over whatever it is, what about how many people have like a major bleed? That would be like a critical hemorrhage.
Yeah, a life-threatening stroke, for example, a bleed in the brain or a bleed in the eye,
or a GI bleed,
or a huge GI bleed. You're looking at 1 person in about 3,300. So you've got a slight benefit here. 1 in 2,000 are going to be improved by it, and 1 in 3,000 plus are going to have side effects that are just as serious.
Well, there are a lot more side effects than a major bleed, too.
Exactly.
Like there's ulcers and there's Reyes syndrome in children, and there can be kidney damage, and you could bleed in your eye.
You can have anaphylactic reactions. I mean, there are a lot of things that can go wrong that we don't really look at when we're looking at the whole picture. So when we're studying these things, we have to be honest rather than try to sell a product. And that's what happens. And of course, the cardiologists, God bless them, they're trying to do the right thing. But they get so over-focused on the heart that they forget about all these other things. And so they're trying to do the best they can to protect you from having a heart attack or some other complication, heart failure or whatever. And that's good. But whenever you're using a medication, and a lot of the time that's all they have, they do the best they can. But maybe we should be thinking a little bit more critically about, is that really the best thing to do?
And it's also not a good idea to be taking aspirin if you're also taking fish oil or ginkgo biloba
or Coumadin
or Plavix.
Sure, because that just increases your risks again for bleeding.
Or an NSAID.
Yeah, and those people aren't included in these studies. So we're looking at aspirin now, and of course, if you don't give an aspirin to somebody who is having a problem with their heart, with arteriosclerosis and at risk for heart attack, or is at risk for a stroke, everybody gets all excited. Oh, that's malpractice. You got to do it. But look at the numbers. These numbers tell the truth about what's really happening, and we should pay attention to that before we start throwing around percentages.
Okay, so besides medications, there are other things too. Like, how about mammograms? It turns out that mammograms have more harms than benefit.
In my opinion, that's true. And in the opinion of people in Switzerland, that's true as well, because they don't do them as screening procedures anymore. But I can remember years ago when I was talking to the radiologists, particularly those who were into mammography, they're going, oh no, this is really important. We're saving lives. We know that we're saving 20, the survival rate is for cancer is 25% higher and all that. But as it turns out, that may not be true. It turns out that you have to treat about 1,500 people for 13 years, okay, to be able to save one life. And that's a lot of mammograms. And keep in mind that a lot of those people are going to get cancer from the radiation. And
a lot of misdiagnoses.
Absolutely.
False positives, where they end up with biopsies and other types of treatments, lumpectomies and...
Yeah, lumpectomies and
the radiation.
Exactly.
The other type of radiation.
Plus, it overdiagnoses a kind of cancer that's called ductal carcinoma in situ. It's called DCIS. Those people, only 2% will die from it, and you can follow these people over time, but most of the time, the fear of God is put into the patient. Well, 2% of you will die. Maybe you want to do something now, and the other 98% are going to get treated, and they don't need it. So the whole field needs to be revised. We need new tests, new standards that are safer, that don't have all these terrible side effects to them.
And then another example would be antibiotics for ear infections.
Right. You look at kids, and we don't want our kids to suffer. And so a child has an ear infection. We're all running to the doctor and saying, there's an ear infection. Let's treat him. What are you going to do? And the right answer, according to the Academy of Pediatrics, is nothing. Do supportive care. It's not a good idea to give antibiotics. The antibiotics cause more side effects than they do benefits in this case, because they don't do much to relieve pain in the first 24 hours, which is the big thing. They don't do much or anything to prevent complications, and they do put you at risk for the side effects.
Well, the other thing, too, is that most of these ear infections are viral infections.
Exactly.
And we all know that antibiotics don't do anything for a virus.
But nothing good. They certainly do some things that are bad.
They don't do anything to help a virus, but they can cause bacterial infections that are resistant to antibiotics.
Right.
And almost all the antibiotics have side effects of nausea and vomiting and diarrhea. And what are some of the other things that can happen?
People die from it. You have anaphylactic reactions. You get rashes. You can get blood problems from it. You can bleed from it. It does a lot of things that are a problem. But the important thing in this particular study is that they found that if you took an antibiotic, it would be helpful in about 1 time in 20. But 1 time in 14, you're going to get one of these other side effects, the nausea, vomiting, diarrhea, or rash. Is it really worth using the antibiotic? I think not.
Well, it's good to know that there are alternatives to treating ear infections in kids if they have pain in their ear. You could use a little warm olive oil in a dropper and put just a tiny bit, a speck of garlic in it. And if you want, you can add a little bit of the herb mullein, put that in there and drop that in their ear. And then you can put their head over to the side so that it's going into their ear, and put their head maybe in your lap and put like a little warm compress on there. And I did that with our granddaughter because she had a few ear infections, and it was like it cured it. She didn't have any more pain after that.
I know what really cured it, darling.
Yes.
It was your caring and loving.
Well, everybody needs TLC when they hurt.
Well, that's a very powerful medicine too. So we have to keep in mind that every treatment we have has side effects, and it has some benefits some of the time.
And antibiotics can have a placebo effect.
Any pill can have a placebo effect, that's for sure. And not taking it can have a nocebo effect for some people, particularly if they think that they need to have this because they're going on a trip or something. But that's more difficult to try and say no to that, because people are so attached to not wanting to get sick when they're traveling. So this whole subject of knowing the numbers of patients or number of people that need to be treated to get a benefit is very important, and the number of people that are needing to be treated to have side effects is equally important. This is information that should be in the package insert. It should be in every direct-to-consumer ad that we see, so that we know the actual numbers, not just the percentages, because they're so misleading. And if we do that, we'll be more in charge of making intelligent decisions that determine what our treatment should be.